All right, Dr. E. First question today. I'm a kindergarten teacher with a student with SM. They whisper answers yet talk at full volume while playing on the playground. I use basic signs with all my students, including this student with SM. I've seen the student use the signs unprompted on a few occasions. Is this something that's okay to do, or should we push for accommodations or interventions?
Brandon, that's a really interesting question. I'm not a real advocate of using signs. In certain situations, I will use sign language as a basic thumbs up, thumbs down means of communication for a young child, especially to make their needs known, and a basic accommodation within the school setting if they're not able to use transitional or verbal strategies. In this particular case, you are using sign language for all the children. Something that's really important is that we don't want to set this child up to be different. So we certainly don't want to tell the child you can't use signs. However, you are using signs. Since this child is whispering, which is a very quiet voice, that's an indication to me that they are in the verbal stage. Their quiet voice is due to a few reasons. Number one, they don't have the social comfort, the confidence, and the verbal comfort in a larger group. Perhaps they're a sensory child and they are overwhelmed, they aren't as comfortable, and their voice goes down. The louder, the larger, the more people in an environment, especially if they aren't comfortable with the majority of individuals, the child will speak in a whisper mode. My guess is on the playground, that child is playing around with their friends and they're just kind of losing themselves and just kind of getting out there. Also, if they're not confident in your asking academic based questions, sometimes voice volume will go down. So there's the answer to the whispering. So we have to work on that. But as far as the sign language goes, I'm just really cautious with trying to tell this child not to do it. But here's what I would do. If you know the child can answer verbally and they use sign language, repeat the question to help them stay verbal. For example, rather than ask yes, no questions where the child can do a thumbs up or a thumbs down, perhaps say, do you want the red or the blue? That's really hard to sign unless you're teaching them each letter of the alphabet. And even then you can say, well, is that red or blue? And try to keep them in the verbal stage, even by writing it out, red or blue. So you're actually using strategies to bridge them up into verbal.
So this might not be an SM related question or follow up, but why is this teacher using signs with her students?
Actually, that's a very insightful question. I'm really not sure. It's possible that this teacher just, maybe there's a child that's deaf in the classroom. So the teacher's trying to be all inclusive. The other thing is maybe this teacher was taught that for a child with SM, that using sign language is a very viable way for communication. And so the teacher did that out of the kindness and also to help that child participate and not make them stand out. So it's probably one of those two reasons. However, as I said at the very start of this question, I'm not a huge advocate for this very reason, that it gives these children a means of staying nonverbal. In other words, if she's saying sign language in terms of thumbs up, thumbs down, that doesn't bother me if they're trying to make their need known. But if you're literally teaching them sign language to communicate nonverbally consistently, I am not an advocate of that at all. And it usually, for many kids, keeps them in the nonverbal stage of communication.
Right. It's like avoiding almost.
It's just keeping them there. One thing that is really important to understand is that, yes, the bridge is something to know and understand, but we're not trying to keep a child nonverbal. The bridge allows us to know where that child's baseline is, but we're always working on trying to help that child bridge into verbal communication. We're using strategies, intervention. We're setting up the room, the buddy process, the small groups in the room, the small groups out of the room, teaching teachers specifically how to question, when to question, where to question. Various strategies, use the visuals, choices, direct, write and read. I mean, it's really a recipe for every single child, Brandon. And so using nonverbal communication is an accommodation. To me, it's not an intervention, unless that child's a shutdown child. So the next step of an intervention is helping them become nonverbal, but that's not what's happening in this particular case.
Are the use of signs on the bridge, is that part of the bridge?
Well, signs in terms of thumbs up, thumbs down, nodding, pointing, gesturing, writing, that's nonverbal. So that's
Hmm.
stage one. So if a teacher says, "Do you want to go to the bathroom?" and the child is nodding, believe it or not, that's a stage one because the child is responding in a nonverbal means. If the teacher says, "Do you want red or blue?" and the child's not able to say it or use an intermediary in that particular situation, or sounds to words, whatever strategy, a transitional strategy that teacher may be using. And the teacher says, "Do you want red or blue?" And the child points to the red, that's nonverbal. That's stage one. If the child writes it and shows it, that's stage one. So that's responding, stage 1A. We do
Okay.
work on initiation, like stage 1B, where maybe we have a goal or a game that the child comes up and lets the teacher know it's time for recess or time for lunch, or they're playing games. I had a child the other day that we were working on nonverbal initiation. They weren't able to be verbal, but they were getting comfortable nonverbally in the session. I wrote the word go on a piece of paper. So when he was playing games with one of my supporting clinicians, and it was that clinician's turn to go with the game, the child pointed to go so that the child was non-verbally stage 1B initiating. So you actually have to teach these kids, believe it or not, for many of them to be nonverbal initiative or even verbally initiative. You can't just wait for these things to happen. The teachers have to ask questions. "Hey, Robbie, would you go up and give this math book to Sarah?" That's nonverbal initiation, stage 1B. By teachers prompting, facilitating. One of my favorite statements is "don't wait, facilitate." The teachers have to, the parents have to provide the interventions to help this child bridge up. Now, a bridge is not stepwise. It's not like you have to just master that one stage. You can there's many kids that are nonverbal or building nonverbal skills. As soon as I ask a question, "Do you want red or blue?" for example, and I write it down, there's children that might read red. So it's not a linear situation. It's an awareness and knowing what strategies work for that particular child.
Okay. All right. Let's move on to question number 2. I have a 7-year-old girl in kindergarten with SM. We began exposures, fade ins when she was in preschool last year. We also tried playdates exposures outside of preschool. In kindergarten, she has been doing weekly lunch bunches for about 15 to 20 minutes with one or two of her peers with the school counselor. Despite these exposures, we haven't seen much improvement. Do you have any recommendations on how we can get her past this stage? We're thinking about medication, but my husband thinks that the SM would just come back once we take her off the meds.
Wow, this is a lot going on in this question, Brad. A lot of stuff is going on. Here are the things I'm thinking about. I'm hearing the word exposures, exposures, exposures. Exposures are fabulous. What are you doing during those exposures? Are you using specific interventions that were developed for your child? Or are you just putting her in these environments? Are the teachers asking questions in the right way? Are they pairing and grouping her with the same buddies that you're working on play dates with, that you're doing small groups with? And even when you're doing play dates, are you transitioning those play dates into the school? Are you playing games and activities using strategies to bridge that child into verbal communication? To me, you're doing the lunch bunch, you're doing a small group out of the room, you're using one or two peers. I would just say, are those lunch bunches with those one or two peers with the same buddies you're pairing and grouping that child with? So that's the setup. Everything I just said is what I call the setup. It's setting up the environment, but it's the strategies, it's the interventions within those settings in the lunch bunches with those one or two peers, making sure they're the buddy process, the same peers you're pairing and grouping with, working on outside play dates, transitioning into the playground, the empty class, into the room, and doing those strategies. So I'm not hearing anything about strategies. I'm just hearing exposures. So it's a very two-prong approach to be able to treat a child and you never hear the word accommodations without interventions. So all I'm hearing is accommodations. We're doing it, we're setting her up. And so again, I don't even know what the fade-ins that you were talking about originally, because fade-ins are great and I'm an advocate of it and we use it, but what are you doing during those fade-ins? So I think the key here is talking to your treatment professional about what strategies to use in those environments. I'll give you an example. If your child has progressed into speech through the strategies and the strategies you're using at home during play dates, whatever those strategies may be. For some children, it's simply running around outside. They get comfortable, they get verbal. Sometimes it's through facilitated play dates where parents are doing an activity with a child that the child loves and feels confident in, and they're bringing them into social communication by the way they question. Do you want red or blue? No answer, red or blue, tell me. And they start verbalizing or sounds to words in a very strategic way. It's not just sounds to words, it's how you use sounds to words for that child, for your child. So I'm not hearing that, right? So I think the first step here is really figuring those strategies out. And that's what your expert in SM needs to be doing with you. As far as medication goes, I'm not telling you whether to use it or not. I'm an advocate of medication when needed. And what does that mean? It means that you're using the strategies and interventions, you're providing the accommodations within the school, you're setting up the world for this child out in the community, exposures, etc., playing the games, doing the goals, and you're doing it all, and the child is really anxious, really stuck, or they have other reasons that are enhancing their anxiety, social anxiety, generalized anxiety, separation anxiety. Perhaps they're a very sensory sensitive child and they get incredibly overwhelmed and shut down in community settings. I mean, you can hear, I can go on and on all day about this question. But if medication were a choice, before I would use medication in this particular child brand, what I would do is really talk to your SM professional and get those strategies. It's not just exposures. What are you doing? And really work those strategies. In my experience, when the parents are taught strategies of how to use them and the child is practicing those strategies within a treatment session and the school is providing the proper interventions and they're using those strategies in the small groups in and out of the room, they're pairing and grouping, asking questions the right way. Usually, obviously, using visuals is critical for every child because that helps minimize the need to think and process, and then they hear the answer with choices. There's lots of beginning ways to use that. Some kids use sounds to words and it works like a charm, or a ritual sound approach because this child is 7 years old. So again, I don't want to confuse our listeners, but I think what you're hearing from me is every single child is a recipe of strategies and interventions, and you set the world up that's specific for that child. Of course, many strategies and interventions are similar for different children. It's how you put it together. And I'm not hearing that at all in this question. So before I would use medication, I would really be sure you're using all those strategies in the right way. And if you use medication and you titrate it up incredibly slow, where you're monitoring side effects as well as progress, and the child gets to a point where they're seeing and hearing themselves successful, usually 9 to 12 months, we usually like a period of time, and then you slowly wean off. I mean, I don't have any cases where the child just goes back to SM, but I can because all along the way, even with the weaning, you're making sure that you know how to use those strategies if the child does start to bridge down, for example, which they typically don't because the child has seen themselves a certain way, hear themselves a certain way, have built the comfort, have connected with peers, have progressed one-on-one, let's say, with a teacher in speech, whatever they may be. But the child becomes a more functioning individual socially, emotionally, academically, and of course, communicatively. So therefore, weaning is really a slow process. But again, I don't have a child that reverts back to selective mutism, but I can see that happening if you have a child that is just being exposed, using exposures and setting up the house, so to speak, setting up the world, but you're not using the interventions, because you're absolutely correct. That child has not built the coping skills yet, Bran, and the child is just using exposures. Maybe that child will progress into speech, but if you as a parent don't know the interventions to use to help that child make, bridge up or bridge down, then what's going to happen if that child goes silent when you take the meds off? You don't have the strategies to bring them back. And again, because these strategies, and I'm teaching these parents all along the way of how to bring that child into communication, when to do it, how to do it, what do you use, what questions do you ask, pairing, grouping, etc., teaching teachers how to question, when to question, with who to question, etc., etc., and what strategies. The kids don't go back to SM because they know it. It's in their toolbox. So even if the child bridged down, the teachers are accepting where they're at, and maybe they know why that child bridged down. Maybe for a sensory child, it's a loud, large, lots of people environment, and they're shut down. Maybe they have insecurities with learning. Maybe there's and they see their peers rushing through the work and the child gets very anxious because they can't do it. Is it their insecurity? Is it a learning challenge? Maybe they have a speech and language issue. So you're asking open-ended, thought-provoking questions. But meanwhile, they have an expressive language disorder. I mean, you can see that with different whys, you need to understand that. That's why I'm so big with the whys. And I repeat this all the time. You need to understand why a child developed SM and why it is continuing. You don't have to focus on it. Once you know it, you focus on those whys, but you're not like constantly saying, okay, my child was, has a learning challenge, This is why they're not speaking. You accommodate that learning challenge. You accommodate that speech and language, and you use, paraprofessionals. You use a multidisciplinary approach to support that child in areas. Now, maybe it's just a timid, sensitive, highly sensitive child. So there isn't anything that you need any sort of learning support for, but maybe the environment is causing that child not to perform at his or her best. So I think you're hearing a lot with this one question.
Yeah.
Why are you laughing?
That was unbelievable. I was like,
I
hey
mean,
man, I don't even have a follow up.
I think it's just like I get the question in my head and I just picture this scenario. And so because I've just seen so many cases and so many families come to us with having seen doctor to doctor, or therapist to therapist, and it's like, okay, well, what was missing was, and you know what's missing. So when I hear this question, I feel what's missing. Now, if this family just didn't include in this question that we are using strategies, we are knowing how to question, when to question, what to pull out, when to ask choice questions, using the visuals in a proper way. And in our case, we use the bridge that gives a very secure, control-based visual guide, a sense for the children to understand where they are on the bridge. It's like a roadmap, right? And so it helps them feel in control, the bridge, so they know where they are and what they're working towards. So it's a very cognitive approach that we use in treatment, and we base it on their feelings, and we teach them how to rate and grade their feelings, and we teach parents how to question them about that. And we are very supportive and understanding, which so many therapists are, don't get me wrong. But for us and for me and for those that I train, I think the bridge is just critical. And what I've seen is that when children understand the bridge, when they understand how to rate and grade their feelings, and they know what the games or goals are they're working on, and it's done in a way that trusts their feelings with us guiding them, right? We're facilitating, the kids do fabulous. Whatever strategy, recipe you're putting together. And so maybe they're doing all that. Then yes, maybe medication is the next step. And as long as you understand as parents how to bridge, when the child bridges down, you understand why that child is bridging down, and you understand what strategies to use to either accept them in that environment or to bridge them up, and how to bridge them up. That's going to be critical here, Brian. It's just critical. I'm just a big advocate of setting up the world, but also doing the interventions before I would jump into medication.
All right, let's move on to question number 3. My child is in kindergarten and doesn't feel comfortable asking to go to the bathroom, and won't drink water from his water bottle because he doesn't want to ask to refill it later on. What's the first step to getting him to move in the right direction?
Well, I think we have to understand where that child is in terms of baseline stage of communication and accept it in times of need. So, for example, using the bathroom isn't a time to use strategies to progress a child to bridge up necessarily. So if the child had a means of communicating non-verbally, for example, some children, the teachers will have a board, like a kind of a communication board on their desk. The child is told, if you have to go to the bathroom, maybe just put your hand up. If they're not comfortable coming up to the teacher's desk, there's a communication board on the wall. The teacher just kind of knows every hour to ask the child, like, you have to go to the bathroom, thumbs up, thumbs down. That's fine, just to get that child to go to the bathroom. If you're talking about having that child put their thoughts together to say it, I have to go to the bathroom, that sounds a little far based on what this parent is describing. It sounds like this child is kind of nonverbal, or if they are verbal, they are maybe quiet 1 or 2 words. So for some children that are verbal, and if they have the ability to read or even picture read, we can work on, if this is something the child can accomplish, work on a nonverbal means of pointing or if they are quietly verbal, to have them be able to to be able to read that question to a teacher. Just even
Okay.
one word, bathroom. I had a child that was liked humor. And so he had a card on the teacher's desk that said, go, go, go. And the child went, go, go, go. It made it humorous for the child. But in the majority of cases, I use the need to go to the bathroom, not if the child's not feeling well, if the child, in terms of eating and drinking, as a means of accommodating them and where they're at and using strategies and interventions to progress them in other areas. Does that make sense? Because you don't
Yeah.
want to not have them use the bathroom and have an accident. This is only a kindergartner, right? And
Right.
embarrass themselves just because you're trying to get them to put their thoughts together and say it.
So so if this child is scared to go to the bathroom or scared to ask to go to the bathroom, and then there's an accommodation set up where the teacher knows to ask or drop the key at the desk every 2 hours or some sort of accommodation. How long should that accommodation be in place before you start to say, okay, now we need to move to the next stage?
Because you want to see that progress in other areas. So, in other words,
Well, how
think of
is
it
there
as
is there a time frame, or is
no,
it
there's
really
no time
depends?
frame. No, it's based on the child's progress in other areas. I'll give you an example. Let's say the child started kindergarten completely mute. They build nonverbal skills, they're comfortable nonverbally. I'd say, well, what are you doing to progress them? You need the teachers to start asking. I use the same questions a lot with you in this podcast because it kind of sets the stage for just the example I'm trying to provide of using choice questions. Do you want red or blue? And the child points. Do you want red or blue? The child has a verbal intermediary. Do you want red or blue? Tell Rebecca as a simple, and the teacher repeats with that eye contact as the basic verbal intermediary. Of course, there's ways to kind of adapt a verbal intermediary based on how that child responds to that. Maybe it's reading. Do you want red or blue? And the teacher writes out red, blue, and the child goes red or blue. Or maybe it's just the first sound. Again, I don't know. It's based on that particular child. Once you get to the child consistently being able to use their words in a way that they're bridged up, you can start to use that for the bathroom. And if you want to do it
Yeah,
simultaneously and the child is responding to that, that's fine. Again, it's every child is different. It's not
but
it's
the
a
goal is to
rubric
get the
for every
speech.
human. Well, the goal is of course, the goal for everyone is to become a confident social communicator. And obviously, that means being a confident verbal communicator. But we also have to understand that we have to help that child, in this case,
Yeah,
reach their capacity. I don't know what else is going on with this child. Are there
right.
other reasons that may prevent that child from being a verbal, confident communicator?
So
Do you know what I mean?
it's always very unique. It makes me realize, or it confirms that beginning of the school year is probably the hardest time of the year for these students because they're just getting comfortable with their teacher and vice versa. So there's probably
I think
a lot of warm up period where there's the teacher needs to kind of understand what they're working with.
Yeah, I do think that that's true, but it doesn't mean if the child is already verbal at the start of the school that they're shut down and highly anxious. It just means that's their starting point. So the
Right.
beginning of the school year and anxiety starting, in some ways, the end of the school year can be very anxiety provoking for children because they got used to that environment, the kids in the class, the teachers, and they've made progress. And typically at the end of the year, most children don't feel anxious at the end of the year, but many kids with SM that I've worked with actually get anxious at the end of the year because schedules change, the
Right.
end of the year, transitions, and many of our children don't do well with that. So it's almost like they're alone in that challenge. Whereas at the beginning of the year, everyone's nervous and anxious for the most part. Not everyone, but the
Right.
majority. So they're
It's a
in
bit
the same boat,
it's different energy for sure.
different energy.
Okay, let's move on to question number 4. It's our last question for the episode. I'm a speech and language pathologist in a public school, and I'm working with a student diagnosed with SM. Our sessions have started off great. The student has spoken with me while her mom has been present. However, her mom just recently got a job and will no longer be able to come to future sessions. Do you have any recommendations for ways to continue progressing without the mom present?
Great question. In a perfect world, what I would have done is try to the child was using the parent as a verbal intermediary stage 2. And so accepting that, I get that that's where they were. However, it was just kind of like dropped off. And now where do you go? In a perfect world, what I would have loved seen happen is that we transitioned that mother out, whether it's increasing the distance, whether it's just a question and the child responds through red or blue, no answer, red or blue, tell mom, and the child just responds blue, and the teacher repeats with that eye contact. And as you ask lots of questions and do lots of activities, the child just starts to speak louder. And what we do is we make that child aware of where they're at on the bridge, and that we hear them, and we have them rate their feelings. So that's like a typical way we deal with it. But for some children, they won't increase the distance. So we wean the mom out by standing up and taking certain number of steps out, or we may start with close up, fist length, half an arm, full arm. Some kids use measuring sticks, popsicle sticks. Some young children will use like a toilet roll holder. They decorated a paper towel holder, etc. They have fun with it if they're young. Some just use fist, half an arm, full arm length away, and we chart it. So they see where they are at on the bridge and moving across. So that's how we would possibly wean from the verbal intermediary. When you don't have a parent or an intermediary, in some cases, maybe the mom has like a picture of her that can be her intermediary, or a finger puppet of some sort. There have been many kids that will use something to represent their parent and actually use an intermediary, even if it's a stuffy or something, like a stuffed animal. That's one way for young children. But if you're alone with a child and the child's completely mute, a really great transitional strategy, assuming this is something that the child gravitates to. In other words, when you kind of expose the child to a sounds to words approach, the child gravitates and does it. And you'd be surprised how many do when you do it in the right way. So using sounds in a very stepwise fashion, sounds to words, or a ritual sound approach, when it's a very kind of using the bridge and doing sounds, putting a few together, charting it. It's really a kind of an art using the ritual
So,
sound approach.
so just to go back to parent being present versus not being present, parent can't be present. First off, why is it easier for a child to speak, or sorry, to progress into speech while a parent is present versus not
Some
present?
children won't do that with a parent because they feel the expectation and they won't do it. Other children, think about it, you're the most comfortable with your parent. So
Mhm.
that's a comfort for them, right? Without their parent there, they don't have that comfort. So if a
Yeah.
child, and the parent's the one facilitating strategies out in the community and outside of school, that's their parent. So having that person, now this could be a peer. In a perfect world, maybe this
Right.
child has progressed into speech with a peer, had play dates, small groups in the room, etc., small groups out of the room. Maybe they just spontaneously began talking to a peer, even if
Mhm.
it's quiet, one or two words to a peer in school. That would be a great way to do this group,
Right.
is bring in some peers, and then that peer is a verbal intermediary.
Right. Yeah, that's kind of what I was getting at. It's like, okay, mom can't be there, but maybe your older sister can come in, or a friend can come in, or even like a relative,
But
a
the key is
cousin.
to wean that person away. Like
Right.
every time you're together and you're keeping that child at that same level, then okay, that's great. But now what? Because the goal is to wean mom out. We don't want her in school all the time. So I
Right.
would want to build connections with peers and get peers to be intermediaries. But I would say that some children with comfort with that speech pathologist through just sounds to words and asking choice direct questions, write and read. I mean, it's possible this child will speak. This happens all the time in session with us, where we'll have a
Mhm.
child completely mute in school, but it's just how we ask the questions. And parents are often floored. How did you
Mhm.
get this to happen? It's like, well, we're not magicians. It's like, we knew what strategies to use based on that child's presentation. And again, I don't know who this child is. I don't know the whys of SM. I don't really know baseline stages in classroom. I'm only taking what the speech pathologist is telling me. Hope that was helpful, Brand. This has been a great episode.
Yeah, we wanted to focus on children. Next time we do Doctor and Ask Dr. Reed, we're gonna do an episode answering questions people have about their teens. But always really good to hear your thoughts. And I hope everyone likes the episode. Any final words? Any specific questions you wanted to
I
bring back
think
up?
they, I think these were all great, very thoughtful questions. And as you know, Bran, we're really big with people submitting questions. Like we want our listeners to submit questions. We answer these questions, right? We do our best
Mhm.
to answer them. There's countless questions that come in. So what we do with some is if two are similar, we may merge those questions because they're often very similar questions. But we do our best, Bran. And whether
Mhm.
it's blogs, whether it's social responses. We do it a lot on the podcast. But what an overwhelming theme is for me with all of these questions, and often almost every Ask the Doc, is I don't know this child. You can't obviously present me with a full case, but for
Yeah.
every child with SM, every teen with SM, you need to understand them. You have to understand them before you can even develop strategies. Some kids will respond to the most
Mhm.
basics, but then they often reach a standstill. Every child is a unique being, and how you put those accommodations and strategies into place, interventions into place, is based on those child's needs. And it always starts with, why did this child develop it? The whys. What's maintaining it? Right? And what are the child's
Yeah.
baseline to know where to start? And when you do make the progress, and we do this in our selective mutism evaluations, when we see a family, is that we start to see what are the best beginning strategies. And then in our treatment, whether it's individual or our Communicamp program, this is where kids are practicing those skills in groups and one-on-one. And then parents are learning this. I really wish our listeners would consider intensive group treatments. For us in schools, they're seeing themselves make the progress. They're hearing themselves make the progress in school. And parents are having all day parent education for 3+ days. I mean, you can't beat
Yeah.
that. They're learning the skills. The kids are practicing the skills. So for parents that are really looking for additional ways to help and support their child, I really encourage you to look into intensive group programs for selective mutism. And again, I'm excited. I love it and can't wait to do our teen program, Bran.
Yeah, we're every time we ask these questions, they're so specific to what people are going through, but I feel like the goal is to have you answer them, and people can take, even if it's like one little piece of what you're answering, and they can apply it to what they're dealing with. So, all right, well, that wraps up another great episode. We'll talk to you guys soon.
Thank you, listeners. Bye, everyone.